back to the program. Joining me now, Rachel Bunch. She's the Executive Director of the Arkansas Healthcare Association, which represents a lot of nursing homes and assisted living facilities across the state. Good to see you.
Thank you. Thank you very much.
And I'm seeing you for the second time this week because there was a big press conference this week where you guys kind of cut the ribbon on your Little Rock Nursing School. It's one of three. There's one in Jonesboro, one in Rogers that you guys are doing. Tell everybody a little bit about what is happening there.
Yeah, so thank you for attending our event. Of course, always good to have you there with us. So this week was really exciting for us. We got to cut the ribbon at the grand opening of our nursing program in Little Rock. As you mentioned, we've got 3 locations around the state. Brand new LPN program for the state of Arkansas, but a brand new program and approach, the first of its kind in the nation. We're really excited about it, the opportunity to upskill current workers in our long-term care facilities into the nursing profession to work for us.
Yeah, let's talk a little bit about that too, because you come in typically, if you're at ground zero in the nursing home industry, particularly as a healthcare worker, you're probably a CNA, a certified nursing assistant. There are so many different rungs on the ladder you can work your way up to, and that's what this program is designated to do, right?
Right,
that's right. Explain kind of what's the next level and then what's the next level and how you guys will do that internally, really, because you're not taking outside candidates, you're taking candidates from existing nursing homes.
Yeah, so this program, one of the unique things about it is that it's completely employer sponsored. And so we're taking workers that are in our facilities already and hope to recruit more from the public to come to our facilities, but to climb the career ladder and have a nursing career. So it starts out with CNA is the entry level, and traditionally those CNAs, it's been hard for them to go back to school. Once you start working and you have a mortgage payment and a car payment, it's hard to go back to work. You've got bills to pay, but this will give them an opportunity to further their career while working at the same time. So they'll go to school part-time, they'll work part-time, and it's a 10-month program, and they'll be able to sit for the NCLEX exam and become an LPN at the end.
Yeah, I mean, it's awesome. Of course, I've spent a lot of times working and covering and reporting on your industry and seeing how hard those and dedicated some of those workers are, and they do some of the most thankless work on the planet. I mean, taking care of people sometimes whose families have forgotten them, and just the connection that they have with some of those residents is just, to me, is so powerful.
It's powerful, it's precious, it's really important work that they do. One of my favorite statistics about the students in our first round of the program, so they start out, as I mentioned, as a CNA, and then they're going through our internal program to become a medication assistant, and then before they start the LPN journey. But of the 70 students that are in our first program, the average time that they've worked as a CNA in long-term care is around 10 years. So these are people who are dedicated in our rural communities to caring for these people at really sick and difficult, hard times, and they've put in the work and definitely deserve the opportunity and are willing and dedicated.
This is not just about giving a promotion, but this is also about meeting a critical workforce challenge. You've got retiring nurses, you've got retiring workers on the front lines up here. So kind of speak to me a little bit. I don't know if you've got statistics on it or not, but speak, and I don't need them if you don't, but just speak to me just about how difficult it is to keep that workforce intact and how important it is to keep that workforce intact.
Right, so workforce is of course critical everywhere, but in healthcare it's ever changing, and it can be a fluid situation. We have people retiring, we have new residents coming in and patients. It's a changing landscape, but we are constantly needing new nurses. You hear people talk about the nursing shortage all the time. You hear in legislative committees discussion about staffing agencies and providers stealing from one another and recruiting away and all of those things.
So that's going to stop with all this,
right,
isn't it?
Right. Yeah, sure. But we're just trying to do our part to help grow the pipeline. But the numbers in Arkansas, the number of LPNs has been declining over the last 10 years that have been coming out of the traditional programs. And so we've seen a decline in the number that have been produced, but an increase in the demand that we have in our facilities. Long-term care facilities are the largest statewide employer of LPNs, and we are hoping that through this model they can become LPNs and then take the next step, and we hope many of them will become RNs too.
Where did the idea for this originate? So, I mean, obviously we've been talking about this. I can go back into the late 90s when the nursing shortage and crisis there was task forces at the state legislature. This is not a new problem, but this is an innovative program. It's the first in the nation, as we mentioned, because it's employer sponsored. Where did the idea for this originate? I mean, Were y'all just in a meeting and somebody had an aha moment, or did?
I don't think so.
Yeah.
So, many years of discussion have kind of led to this. But I think when we added the medication assistant licensure level to our staffing ratios, the staffing that we do in our facilities, that was added in a couple of legislative sessions ago, and it was really an attempt to alleviate the burden, the day-to-day burden from the nurses in the facilities. And so we saw that as an opportunity. There weren't enough programs out there that met the working kind of scheduling needs, and so we created our own. And in the last around 18 months, we've seen over 400 CNAs complete our program that we've done through the association. And at that point, we had a lot of momentum, and we had a lot of employees, medication assistants then working that wanted to continue furthering their career. They wanted to keep growing. They wanted to keep moving up the ladder and learning more and providing a better service to those people that they serve. But they've had trouble getting into the programs, the existing programs. A number of reasons: scheduling, money, the ability to go back to school and take your ACT when you've been working for 10 or 15 years is scary. I wouldn't want to do it today.
Right.
I wouldn't want to do it. But just a number of different barriers, and so I think this program is put together with the intention of non-traditional students. Their tuition is covered, so they will go through this program, as I mentioned, work part-time and be in the classroom part-time, but their tuition is covered, and then they'll have a guaranteed job in the facility when they're finished. But we're trying to make some of those barriers that we've heard from them over the years, either eliminate them or make them easy for our students. And so I hope that will help.
We got a couple minutes left here, but I want to get your take on a very important issue. Lots of discussion about Medicaid changes at the federal level. This obviously all of the long-term care facilities that you represent, as well as hospitals and many other medical providers, will be impacted by changes that come at the federal level. With what you're seeing up there right now, are you optimistic? Are you pessimistic? What are you kind of preparing for?
So we've been watching this, of course, very closely. Kat and I were in D.C. last week for some meetings, and we met with both of our senators and their staff members. We've been in constant communication with them about this. Right now, we are optimistic. The most recent text from the Senate Finance Committee holds nursing home provider taxes harmless. So we are very grateful for that, and very grateful for both of our senators and the communication that we've had with them about the subject. There are a number of things related to Medicaid, as you're aware, that are kind of on the table and being discussed right now. For us, the big priority is the provider taxes, because Arkansas gets 6% provider tax for nursing facilities, and we've had that in place for many years, and we rely on that to help with the state budget, and our facilities help front that money, and it works with the state for the Medicaid reimbursement that most of our elderly Arkansans rely on. And so the current version from Senate Finance Committee holds that harmless, so we are optimistic and grateful there. There are a number of other things in that proposal that don't necessarily affect us, so I'm not here to say that everything's good or bad. I can't comment on the other parts. There's some language in there about the retroactivity that would definitely change and probably be a barrier for the patients that we serve, as far as the timing and getting them enrolled, and everything moves. It's so difficult when you're dealing with these situations and patients. So that's something that we're watching as well. We would have to adjust to, but for right now, we're optimistic and appreciate the communication from both of our senators.
All right, Rachel Bunch with the Arkansas Healthcare Association. Thanks for being here. Good luck with this program.
Thank you.
All right.